Hi, everyone, and thank you for joining us for this evening's webinar. This is the last of our integrative therapies and nutrition series. Tonight's focuses on improving treatment-related bowel changes through nutrition. Before I introduce our speakers for this evening, just have a couple of things to go over. You are in listen-only mode. That is just to minimize any audio distraction. But we do welcome your questions. And we'll have time at the end for a Q&A session. If there's something you'd like to ask our presenters, you can click on the chat icon at the bottom of the screen and type in your question. Only myself and the speakers will see your question. The session tonight is being recorded and it will be posted to our website for anyone who may miss it or if you'd like to watch it back. And lastly, we just ask that you don't share any personal medical information or questions in the chat box. If you have a medical question, please ask your doctor. And now I'd like to introduce our presenters for this evening. Samantha Bateman is a clinical nutrition specialist. She enjoys providing evidence-based medical nutrition therapy and support to individuals with cancer and cancer survivors. Meagan Currell is a clinical dietitian. She has a passion for oncology nutrition and has experience working in both in and outpatient settings. Thank you both for being here. And I turn it over to you now.
Perfect. Share the screen. Okay. Well, thank you everybody for joining us. I'll speak for both Meagan and I that we're super excited to have everybody here, and hopefully we can provide some helpful information. And we, again, to echo Devin, we welcome your questions at the end, and we'll try to get to as many as we possibly can. So just to kind of give you an agenda for the presentation tonight, we're going to look into the causes of both constipation and diarrhea, why we want to prevent and treat constipation and diarrhea, the negative effects, and how to do so. So we'll talk about different strategies for both constipation and diarrhea. Okay, and there's also a couple products that can be helpful that are over the counter that can help with both. Just a quick definition for both. Constipation is considered a decrease in frequency of bowel movements and or hard to pass stool. So if you normally, have a bowel movement every day and then you are not going every day, maybe going a couple times a week, that would be considered constipation, as well as if you find yourself straining and just really having a hard time having a bowel movement, that would be considered constipation. And then diarrhea on the other end, if you have an increase in stooling, so 3 or more stools a day, or an increase in the liquidity of bowel movements. So if they're a little bit more soft, as well as just more liquid than normal, that would be considered diarrhea. This is kind of it's a very helpful chart, but it's a little, some people find it a little silly, but the Bristol stool chart is super helpful with getting an idea of where your bowel movements lie. So there are different types. Type 3 and type 4 are considered normal. Type 1 and type 2 are variations of constipation, and type 5 through 7 are variations of diarrhea. So as tough as it may be to talk about your bowel movements with your provider, it is really important to be specific if you see changes in frequency or in what they look like. It can be really helpful for us as dietitians to give you helpful information, but as well as any other provider that asks about your bowel movements. And then also it's important we will get into how to use fiber in helping with both constipation and diarrhea. And it's important to differentiate between soluble and insoluble fiber. You'll find a lot of different foods with both, but soluble fiber, it does dissolve in water, and this is really helpful with slowing down diarrhea. So I'm sure a lot of you have heard about the brat diet, which we'll talk about a little bit more later on. But foods that are higher in soluble fiber, bananas, toast, rice, these can help slow down diarrhea And then insoluble fiber can actually help promote the movement of stool, so it can help with constipation. And this type of fiber is found in whole grains, the skin of vegetables, and we'll talk about a couple different options with insoluble fiber as well. So the causes of constipation, different types of cancer treatment can cause constipation. So certain chemotherapies, especially the vinca alkaloids, the vincristine, vinblastine, vinorelbine, all of these chemotherapies can cause some form of constipation. And opioid medications, if you're on medications for pain, these also can cause pretty significant constipation. It can be really uncomfortable. And other nausea medications like Zofran or the generic is ondansetron, all of these medications listed can cause some form of constipation. And then your tumor type or the location of the tumor, if it's in your large intestine, it can cause a partial blockage, which makes stooling a little bit more difficult. The stool can have a harder time passing that blockage. So that can make it a little bit tougher to go. As well as if you're not drinking enough fluid, or if you're just chronically dehydrated, the stool, it needs enough water to soften so it can pass easily. So if you're not drinking enough water, that can definitely make things worse. And if you normally are a pretty active person and then, for one reason or another, you're not able to be as active as you previously were, you're heading into more of a sedentary lifestyle, that can cause changes in stooling and cause a bit of constipation as well. I do want to touch on opioid-related constipation. Most of the providers will give you some form of a bowel regimen if you are on some form of narcotic for pain, just because constipation is pretty much inevitable for most people. And it's usually a combination of a laxative, multiple laxatives in some cases, and a stool surfactant or softener. These drugs can be over the counter and they work in different ways, but they can be really helpful. And sometimes what we recommend as dietitians, as helpful as they may be, it just may not be enough in this case. So using both nutrition interventions and the medications, the bowel regimen recommended by the care team, is super important so they can work together to help get things moving along. If anyone has experienced constipation, it is not comfortable whatsoever, but just to kind of go over the negative effects, the feeling of fullness or pressure in the abdomen, it's just uncomfortable, but it can also cause a decreased appetite and intake from a nutrition standpoint. So if you're really trying to maintain your weight or even gain weight during treatment, this can be a barrier. It can be really tough to get a good meal in if you haven't had a bowel movement in a couple days, especially if you're used to going pretty frequently. And if it's really pretty bad constipation, it can actually cause nausea and vomiting, because if there's some form of blockage, there's nowhere for the food that you're eating to go, and it can make you feel nauseous and it can actually come back up. And also, if it continues, 4 or 5 days without having a bowel movement, that can be really dangerous, and it can actually cause a need for a hospital admission or even more invasive intervention. So we want to try to stop that from happening. And then also pain and straining with bowel movements. In some cases, if you strain too hard, it can actually cause a form of passing out. So we want to prevent that, as well as treatment delay. If you don't have a bowel movement, you're not feeling well, we want to avoid delays in treatment at all costs. Now, to get to the nutrition strategies for constipation, I know I mentioned making sure you're drinking enough fluid is really, really important. But how much fluid do I need to drink? I mean, that's a big question. So for most people, about 64 ounces is a good place to start. Some people may need a little bit less. Some people may need a little bit more, depending on height, weight. There's a lot of different factors, but 64 fluid ounces or eight fluid ounce glasses is a good starting point. And then warm liquids, they absolutely count towards your fluid intake, and sometimes that can be enough to help get things moving. And then physical activity. Gravity is your best friend when it comes to getting things moving with your stooling. So even if it's just a light walk or just trying to get up and moving as much as you can. And then prune and apple juice can be super helpful with just getting it. One, it counts as fluid, but also a lot of these juices have sorbitol, which is a sugar alcohol, and that can help get the your bowel movements going as well. And then back to the fiber, slowly increasing your fiber with adequate amount of fluid can be really helpful with getting things moving. You don't want to increase your fiber drastically. That can actually make constipation worse. So in terms of fiber supplements, it's best not to go, 0 to 60 or even increasing your fiber through diet, through fruits and vegetables. If you're not used to eating a lot of fruits and vegetables and then you eat 6, 7, 8 servings of either, that can be a bit of a shock to the system. So it's best to go slow and make sure you're drinking enough fluid to make sure you're not going too quickly with the fiber. And then foods, I know we kind of touched on some foods with insoluble fiber to help get things moving, but whole grains, this is why most dietitians we do recommend whole grains over refined grains for the extra fiber and the addition of the insoluble fiber. So the whole wheat bread instead of white bread, brown rice instead of white rice, whole wheat pasta instead of white pasta. And then fruits and vegetables with peels. So apples, pears, even cucumbers, the insoluble fiber is found in that peel, and that can be really helpful to get things moving. Leafy greens, if you like salads, that's a great way to get some insoluble fiber, as well as the nuts and seeds. So all of these foods are great additions to your diet if you want to try to increase the amount of fiber you're eating and just to help keep things a little bit regular. And then just to touch on commercial products for constipation, there is actually a senna-based tea that I tend to recommend a lot. It's super effective. It's for some people, it can be really, really effective. And what it is, you just steep it like a normal tea bag. You can drink it at night, and then it usually works between 6 to 12 hours later. So if you drink it at night, hopefully it'll get things moving by the next morning, but it can be really helpful. Adding forms of fiber through Metamucil, but also wheat germ, flaxseed, those all can be helpful. And over-the-counter laxatives and stool softeners, as we've touched on earlier, definitely go with the bowel regimen that your team recommends, but they can be really helpful in addition to the nutrition recommendations that we've touched on. And I'll turn it over to Meagan.
Thanks, Sam. So Sam talked about constipation and diarrhea, and then focused on kind of the nutrition management for constipation specifically. So I'll talk about some of the nutrition management tips for diarrhea. And just to kind of remind you, so diarrhea is defined as an increase in frequency or volume of stool. So there are a couple different types and reasons for diarrhea. A big one going through treatment is chemotherapy-related diarrhea. That one is specific to a couple of different types of chemotherapy that are known to cause diarrhea, and those I've listed in the following couple of examples. So capecitabine, irinotecan, these are all chemotherapy drugs known to cause diarrhea. The other cause of diarrhea related to treatment can be radiation, depending on where the radiation is. So if the radiation is directed at the abdomen or the pelvis area, there's potential for radiation to impact the cells that line the GI tract somewhere along your abdomen. So just to be mindful that, it may not just be chemo or something else, but also radiation, and depending on where that radiation is. Another reason is tumor type and location. So if the tumor is neuroendocrine, it is known to cause diarrhea, or if the tumor type is, for example, in your small intestine or colon and needs to be resected. There's potential for malabsorption or diarrhea, maybe even dumping syndrome to happen, which is a large volume of diarrhea. So being mindful too of the type of tumor and its location, that also can cause diarrhea. Certain medications are known to cause diarrhea as well. One of the kind of common ones is antibiotics. So, being mindful of the medications that you're on. Also infections. The one I listed as an example is C. diff, which is it's an intestinal infection that is known to cause diarrhea. So sometimes if there's large volumes of diarrhea, we'll check that. And then the last thing is changes in diet as a result of treatment. So not the chemo or radiation itself, but treatment that in some way can impact what your diet is. So for example, a lot of patients sometimes rely on oral nutrition supplements to help meet their needs during treatment. Those sometimes aren't the best tolerated in a certain population of people and can induce diarrhea. And then enteral nutrition. So if a patient is on some sort of tube feeding and requires enteral formula to meet their needs, sometimes that formula can have a certain osmolarity that draws in water and causes diarrhea. So those are kind of the big ones that are especially treatment related and might be seen by someone going through a cancer treatment. The negative effects of diarrhea are pretty straightforward. Dehydration is probably the biggest one, which is just losses of fluid, large amounts of fluids, which also causes loss of electrolytes. And so, this can be potentially harmful and cause delays in treatment. It might require IV fluids. It might even require hospitalization for further management. So something we definitely want to avoid. Also, I kind of touched on this, but diarrhea can also cause treatment delay. So if it is very persistent or very large volume or somehow debilitating, it may require hospitalization or holding treatment or chemo, as a patient wouldn't tolerate it with the amount of diarrhea they're having. So it's really not a great thing to have for not just treatment, but also quality of life. I've had patients that are, nervous to go anywhere because they are always thinking about where the nearest bathroom is. So, it can really be challenging to kind of do your activities of daily life while having large amounts of diarrhea. And so the nutrition management piece for diarrhea is to avoid the foods that Sam talked about that help constipation in a nutshell. So those are foods that are things like raw fruits and vegetables. I always like to think of those vegetables that have a peel. Those types of fiber are really hard to digest. We really don't digest them well, and it does help to move things through if you have constipation, but we don't want to, promote movement in the GI tract, which is what those raw fruits and vegetables do if we have diarrhea. So another thing to avoid is milk containing foods and beverages. And so that's just one of those things that lactose, which is found in milk, is kind of difficult to break down. And so with treatment, sometimes the lining of the GI tract, the mucosa, can be damaged, which can affect the enzyme lactase, which breaks down lactose. And so kind of just avoiding those while you're experiencing diarrhea is kind of a good rule of thumb. And then what to include, we want to include foods with the other type of fiber, which is soluble fiber. And that's found in things like oatmeal and bananas and applesauce. It's those fibers that are found primarily in the brat diet that we mentioned. So including foods with soluble fiber, and in avoiding foods that are high in insoluble fiber. And then also something to consider is an oral rehydration solution, which we have on, I think, one of our handouts, but it's a combination or some recipe that includes water and salt and sugar usually, and that can help to kind of replete and maintain hydration. So a couple of examples of oral rehydration solutions would be 2 cups of Gatorade, 2 cups of water, and a teaspoon of salt. That's one of them. And then the second one that I have written down is 3 cups of water, 1 cup of orange juice, 3/4 teaspoon of salt, and a 1/2 teaspoon of baking soda. So those are just some examples of the combinations of water and salt and sugar that you may see in some of these oral rehydration solutions to help kind of replete hydration. So this is just another slide emphasizing these foods that we want to include for management of diarrhea. So the BRAT diet, bananas, rice, applesauce, and toast is what that stands for. So including those foods that are high in soluble fiber. So your banana, crackers, toast, rice, oatmeal, all really good things to include if you're experiencing diarrhea. All of these foods are primarily carbohydrate foods. So just keeping that in mind, if you are someone that needs to pay attention to blood sugar, has diabetes, or just in a general nutrition sense, just it's only going to really provide carbohydrates. So balancing that with a little protein and healthy fats is important too. So I then wanted to talk about 2 recipes that are helpful for diarrhea. One are these banana oatmeal pancakes. And so already, if you remember those foods that are high in soluble fiber, they are, these pancakes are made with banana and oatmeal, which are both soluble fiber foods. So the recipe is here for the ingredients, and then our website has kind of the full recipe if you're interested in making these. The second recipe is zucchini basil soup. So this one is made with zucchini, which is largely fluid, and then full fat Greek yogurt, olive oil, and a couple of other herbs. Again, this soup is on our website if you're interested in the recipe. And then a couple of commercial products that are helpful for management of diarrhea. There's so many that are on the market. A couple of really common ones that we recommend are things like the Noon tablets, Gatorade Zero, Liquid IV. And then I like to recommend Smart Water, electrolyte water, because a lot of the electrolyte drinks are pretty sugary or taste sweet or have some other additives to make them taste good. And so the Smart Water with added electrolytes is kind of a nice option because it just tastes like plain water. And then we have Imodium as well, which is just an over-the-counter medication that can help with diarrhea. And then lastly, we have our website. So you can find these recipes as well as recipes to help with constipation management and other side effects that you may be experiencing from treatment.
And just to mention, if you are interested in meeting with any of us, there are a few of us kind of hanging around the cancer center. So just, you can mention that you would like to meet with the dietitian, to any provider. It could be one of the nurses, but your doctor can put in a referral and we can get you scheduled.
Great, thank you for adding that. It's helpful for people to know sort of where to go to get an appointment. That's great. Thank you both so much. We do have time now for questions. So if you haven't already, you can type your question into the questions box and we'll get to it. So there are a couple that have come in. If I take, is there a risk of becoming dependent on over-the-counter medications such as Miralax or Senna if I take them every day for constipation?
I mean, there's always a chance that your bowel pattern could change a little bit, but it really depends on how long you're taking it. The idea is to, if we need to take it throughout treatment, and treatment for a lot of people, it could be a short period of time or it can be a longer period of time. The idea is to hopefully combine those medications with nutrition interventions, so you may not need to be reliant on them. But whether you're permanently reliant on them, it's tough to say. Everyone's bowel pattern is a little bit different. Meagan, I don't know if you have anything to add, but it's
Yeah, exactly. And I mean, if there's like concern for other medical issues from being on something like that too long, it's probably a better question for your doctor. But I agree with everything Sam said.
Thank you. Is almond milk a good alternative to regular milk?
depends. I mean, if you are lactose intolerant, you can't tolerate regular milk like cow's milk, almond milk might be a good option for you, but it really depends on your goals. Almond milk can have a little bit more added sugar if you get the sweetened version. If you get the unsweetened version and you're looking for weight gain, it can be lower in calories and protein. Cow's milk is actually a pretty nutritionally complete beverage, but if you can't tolerate it, that's okay. There are also lactose-free options like Lactaid, but almond milk, it's really personal preference in what your goals are.
If that question was directly related to the management of diarrhea, then something lactose free like Fairlife or Lactaid is a good option for milk. It just doesn't have any of that enzyme in it, so it's going to worsen diarrhea.
And a question about rice. Is rice on both the constipation and diarrhea diet?
So it depends on what kind of rice. So brown rice, which has the entire outer shell, it's less refined, it's less broken down. That outer shell has the insoluble fiber that we're looking for when it comes to constipation. In white rice, I'll turn that over to Meagan.
Yeah, so a lot of the soluble fiber foods do help to normalize bowel. So they'll help with both constipation and diarrhea. So oatmeal is another one like that I think of that kind of just helps with both. And rice is another one of those. So really, I think it boils down to the important piece between the two is to not have insoluble fiber if you have diarrhea, which is the raw fruits and vegetables that help to move bowels.
Is it better to eat raw green veggies than cooked veggies like kale or collard greens?
It depends if you're having constipation or diarrhea, right? So if you are experiencing constipation, it doesn't, like, the nutrition of the vegetables doesn't necessarily change that much if you eat them raw versus cooked. If you cook them a lot, especially if you're like boiling them, some of those vitamins and minerals can be kind of leaching into the water. But from a fiber standpoint, it really depends. Whatever is going to help you eat them is how I like to say. Like, if you really don't like raw vegetables, you don't have to eat raw vegetables. You can eat cooked vegetables. But from a diarrhea standpoint, I'll let Meagan go for that.
Yeah, the raw vegetables could worsen diarrhea. So if you're experiencing diarrhea, I would avoid raw fruits and vegetables. Cooking them might help with digestibility. So it's a good idea if you do still want to include vegetables and you're having diarrhea to cook them first. And then if you're having constipation, those raw fruits and vegetables are actually a good thing to include to move bowels.
Do steel cut oats contribute to constipation in any way?
So steel cut oats, they do have a good amount of fiber in them. It's a whole grain. So it's tough to say if that food alone is causing constipation, we would have to take a look at your entire diet in order to make that determination. And it also depends on how much fluid you're drinking too. But it does have a good amount of fiber. And if it's something new that you've incorporated into your diet that you weren't necessarily eating a lot of, it could be that, adding too much too quickly could have made things a little bit worse. But oats in general are pretty great for both constipation and diarrhea. So it's tough to say. We need a little bit more information. So we can absolutely set up an appointment and we can chat and do a full assessment.
Thank you. And again, if there are more questions, we do have some more time. Feel free to type them in. Couple more. Since you were just speaking about drinking, how do I know if I'm drinking enough fluid?
Sure. So it is a good starting point, right, with the 64 fluid ounces. But honestly, as not comfortable as it is, looking at the color of your urine, that is a great indication. If it's super duper concentrated, like very, very yellow, very dark, that's a good indication that you may not be drinking enough fluid. We're looking for more of a pale yellow color, as well as frequency of urination. If you're going pretty regularly throughout the day, that's a good indication that you're drinking enough fluid, just so you're kind of flushing everything out. But as well as looking at your skin, there's something that we like to look at as dietitians and clinicians. It's called skin turgor. So I'll show you. So if you look at my skin, how it bounces, like rebounds really quickly. I've tried to drink a lot of water today in preparation for this presentation. But if it rebounds quickly, that's a pretty good indication that you're well hydrated. What can happen is that your skin, what we call tenting. So if it stays up like that without me holding it, that may mean that you need a little bit more fluid.
That was helpful to see. Thank you. Does cancer treatment trigger hemorrhoids? And if so, are there any dietary recommendations?
For hemorrhoids, I'm not aware of any specific cancer treatments. That might be a better question for one of your doctors, just because that can be more of a medical intervention for hemorrhoids. My understanding, it's often a topical medication, so I would bring that up to your physician. And from a dietary standpoint, I'm not sure if anything, I know regular bowel movements can help prevent, but from a cancer perspective, I would just mention that to your doctor.
And could you comment on coffee being a good choice or not a good choice for hydration as a warm liquid, like you mentioned?
Yeah, warm liquids are great for helping to move bowels. Coffee especially is one of those, it's a GI stimulant, so it's kind of known to help produce a bowel movement. In terms of hydrating, I think it depends on the overall picture. So if half of your fluid intake is coming from coffee and half is coming from water, then maybe it's not a great source of hydration. We do count those fluids towards your fluid goal. Same as things like seltzer water. They all count towards fluid, but I wouldn't necessarily say it's as hydrating as something like water or electrolyte beverages. But it certainly can help move bowels. It is a GI stimulant and known to help with bowel movements.
And a question about electrolytes. Why is it important to drink electrolyte beverages instead of water when experiencing diarrhea?
Yeah, that goes back to the electrolyte losses and fluid losses that happen with diarrhea. So the goal is to replace those. So your electrolytes are sodium, potassium, magnesium, and those are important for a lot of different things with your cell and biochemically. So that balance is really tightly controlled in your body, and it's important that we're repleting electrolytes that are lost if you're experiencing diarrhea. So it can just be a way to help to hydrate better than drinking lots of water, especially if you are drinking lots of water, you may be actually diluting the sodium that exists in your body. So it's just a way to help replete the electrolytes that are lost from diarrhea, whereas water might not do as good a job of that, or you'd have to drink a lot and at that point might be kind of diluting the pre-existing electrolytes.
Do fiber gummy bears really work?
It depends on the brand. Fiber supplements in general, it depends on what you're experiencing, right? Like fiber supplements can actually help with both constipation and diarrhea, because a lot of them have a combination of the insoluble versus soluble fiber, typically more soluble than insoluble. I personally haven't recommended them. Normally we go with like a Metamucil or a Benefiber, but I will say anecdotally, I've had a couple patients that take them and have success, but normally we stick with a Metamucil powder.
And in terms of commercial products, do you recommend Ensure?
So yes, we do recommend Ensure to our patients, as well as a bunch of other oral nutrition supplements. Ensure is a good option. Indications for drinking Ensure might be weight loss, unintended weight loss. It might be low appetite or nausea. It could be any of those reasons, but yeah, we definitely recommend Ensure to a lot of our patients, and those, I guess, would be the kind of three main reasons.
Mm-hmm. They have a lot of different like varieties too, so it can be helpful for different situations for different people.
And as part of your presentation, you mentioned specifically some foods to avoid. Are there other foods that worsen constipation and diarrhea that are kind of like you regularly recommend people to avoid?
Yeah, for diarrhea, I guess, some people also have triggers with spicy foods or really fatty foods, greasy foods. So again, that's the reason for the bland diet. So to be more specific in why we recommend that, it also goes hand in hand with avoiding some of those highly trigger foods for diarrhea.
Yeah, and for constipation, there's not necessarily specific foods that I would say absolutely no. It really depends on the dose, I guess. Like if you're eating a lot of one food and you're not getting enough fiber on top of that, like if you have a very processed food, like eating out a lot, heavy diet, and you're not getting a lot of fiber, it's more of trying to find that fine balance for each person. It's not necessarily one specific food.
Thank you. So we have just a couple minutes left. If there are any final questions. Thank you, everyone, for joining us tonight. Again, just wanted to remind everyone that this series has been recorded. So this session, as well as the previous sessions, which are listed here, are all available on our website at massgeneral.org/cancer/integrative therapies. And thank you again for joining us this evening. We hope that you found this helpful. And thank you so much to our speakers for being here and providing such great insights. Do you have any last words before we end?
No, just thank you all for coming. It's been a really great experience being involved with this series. So I hope you guys have found something that's helpful with your current situation, and just know that we're always available if you need to talk with one of us, and we're happy to help.
Thank you, everyone. Have a great night. Goodbye.